Welcome back to the Megacast. Dave Scott, Tyler Keefe here. Thank you very much for joining us. We're doing everything we can. Our hands are washed. We've done our social distancing. We've cleaned our surface off. We do it every half hour here on the show. And the guy who gave us all those great tips at the very beginning of this process is none other than the chief of the West Bloomfield Fire Department, Greg Flynn, who joins us now via Zoom. Chief, hello. Welcome to the broadcast.
Good morning, Tyler. Good morning, Dave.
Thank you for being with us. So before I ask you a myriad of questions, what do you got for us? Any updates, anything on your mind today for the public?
Well, one of the things I sent you guys an email about, and we'll see maybe if we can get that up on the screen, is some of the widgets that are out there. And, a widget's just kind of one of those compilations of all the different pieces of information. And the state puts out a widget of its own, and you can see a nice display of kind of what we know are the facts. And the one thing that I heard you talking about with the physician in the interview here just before this one was about the testing, about the number of cases that are coming through. And you can see a nice picture of kind of how those are dropping off. Now, remember, we've talked before, Dave, if testing's taking 3 to 5 days and we're seeing a drop, we want to see multiple days in that drop before we see that we speak to any kind of pattern. And we also need to look at the availability of tests, because if there aren't the same number of tests being administered, one wouldn't expect there to be more positive tests. So we got to be careful with all of these numbers.
Well, that's what the governor's office said in a release, and I'm sure today, when we hear from the governor at 3 o'clock, that's exactly what they're going to say. I'm sorry, I'm an optimistic person. I see these numbers, and they are beginning to look a little bit better, and I know all of you are cautious. Those first responders, elected officials, we got to keep everybody engaged. So we are obviously very cautious about saying anything that would lead anyone to believe that this is over, because we aren't anywhere near. We're not even in that neighborhood. But you got to feel good seeing what we've seen, don't you think?
Well, we should be proud of the community's response. Really, they're the ones that are making the impact here. We're the fire department, and through our engagement with you, sure, there's a preventative part component to what we're doing, but for the most part, right, we're responding to the incident. The community is the one that's doing a great deal of the heavy lift on the prevention, and it's through the continuation of the message, through the Megacast and the engagement, through what you're doing with Premier Pets and bringing like every component of life and how this is having an impact. And you and your team are highlighting that, Dave, and it's impacting all of our lives in that way. And when we can find these nuanced ways of, when I'm out walking Ruby with my wife at night, our Labradoodle, when we see our neighbors, we still maintain that distance. People say, let's get back to normal. Folks, there's a new normal coming. And instead of saying, let's get back to normal, let's find the new normal and start exploring that and do that well.
Well, there's a lot of anxiety, and we wouldn't be honest if we didn't say people are ready to get back to the new normal. People are ready. We'll do what we're told, but people are ready to see some adjustment as soon as it is possible. We're all looking forward to that, and I'm sure it's coming, and the day will get here, but the day will get here when the day gets here, and you can't determine that. The governor can't determine that. The president can't determine that. The virus will determine that, and that's a smart approach, and we'll wait and see where we go with that.
You're right, but we also know through just watching you prep here before this segment and seeing you wipe everything down, right? You're doing those things. You talk about your clean hands and how those weren't necessarily things that you or I did a ton of. Now, I would say, those in healthcare and those that are in medicine have a tendency to probably do more of that, but that's because we're familiar with it. Everybody's becoming more familiar with how viruses are transmitted now with COVID-19. So we're going to be better off on the other side of this. But you're right, navigating to the other side is becoming more frustrating. How do we keep our residents for a few more weeks on board with what we're doing and keeping that social distancing? That's why I think so much of the conversation we need to talk about what the new normal is going to look like. What will, life look like for my sophomore this year? What will life look like when they move up into the high school or into junior high? Those are probably some of the things we need to be spending some time on. We have a good foundation for how to prevent this disease from transmitted now maybe being transmitted. Now we need to spend some time of what the future is going to look like.
Well, I appreciate that. And, you, Craig Flynn, Fire Chief in West Bloomfield, you continue to be ahead of the curve on this, and I appreciate that. You have to be, because you have to anticipate what's going on in the community so you can get ready and prepare for it. And but I think a lot of people are very cautious about talking about what's next right now in leadership positions, because they want to make sure people continue to do what we have to do right now. So there hasn't been a lot of conversation. I welcome that conversation. I think you're right. Let's have it, and let's start talking about what is next. So do you have any thoughts on what our world is going to look like whenever that day comes, and we can at least have at least some level of flexibility in the way we're traveling around our community?
Well, I do, and I want to be careful too. I don't want to say we're there, as you, I think, very appropriately defined in this conversation. We're not there yet, but we can start to discuss it. And, what does a lunch line look like? What does it look like when you show up at Starbucks moving forward? We know what it looks like at Kroger. I know what it looks like at Costco. Is that what it's going to be like forever? And in Greg Flynn's humble opinion, and it's just an opinion, no, I don't think that's exactly what it's going to look like. But we are going to move into a Costco a little bit quicker than maybe what we are right now, because we're going to learn more. And an informed community is a responsible community, and we will take ownership in that disease transmission. And just those little things of creating the space and being respectful of each other's space is going to provide a great deal of comfort. But keep in mind, Dave, as we look at this, and as the physician before was saying, we're going to have folks that get infected, and then they are going to have some degree of immunity. We know that we can't necessarily say that, and I'm not the expert to talk about that. You need a physician or epidemiologist or someone with more background. But history tells us there'll be some degree of defense that our body is going to develop against this. So that will bring back some confidence. But I hope we don't lose some of these best practices, like the simple things of hand washing. I saw on one of the major networks this weekend that they had a poll about handshaking, and it was split darn near down the middle about the number of people that said handshaking will go away and handshaking will stay. That'll be hard for me. I'm a handshaker. You and I have worked rooms together, so that'll be a hard thing to overcome, right? But for my boys, my three sons, maybe not so different for them. Maybe
no, I think we're going to be living in a changed world. I am not an expert on any of these issues, so I can easily offer some commentary and just take a glimpse, because what I say means nothing. I'm a broadcaster. Couldn't be lower in the food chain, but I'm hoping that we can get out of our houses pretty soon. We didn't have these skills when this all started. So getting isolated at home was vital. We had to do it anyway. And now we've learned these skills. We know how to social distance. We know not to shake hands. We know how to wear masks. In fact, I've got I don't know if it's a good look or not, but I've got my bandana here. You can't see it, Chief Flynn, but it's it other than looking a little gangster, it's good. So we know to go out now and cover our face in some way. But does that mean we can't golf? Does that mean we can't go out on our boats? Does that mean we can't go to work in some working environments? Does that mean some of us are going to work at home? Some of us are going to get out? Does that mean we can't go to a restaurant that's configured correctly? I hope those things happen sooner than later, and we've all learned a ton, but I don't see this social distancing or physical distancing going away. I think it's part of our culture for a while.
And I won't push back on that at all. But what I think you'll see is a refinement of that. I think anytime we implement something, the pendulum, so we were over here, it swung way over here, and we're going to course correct probably back to somewhere in here. And what I mean by that is the risk is highest when there's more unknowns. So we know that's when we're really the most potential for disease transmission. What don't we know? We don't know where the virus is. We need more testing. You hear that all over the place. But remember, that's more complicated than just saying we need more. You need a system. You need the labs. You need to be able to process. All of that goes with that, which is not an easy feat to overcome. But once we understand where it is, once we understand who's immune to it, once we have very clear, definitive answers for, can it come through on mail or through my Amazon packages? And do I need to set my groceries in the garage for 2 days, or different things that we've heard? All of that's going to kind of naturally refine out of our culture, and we'll be at that new normal. And I think it's going to be fun. I don't know that driving around in a golf cart is going to be my first choice. I kind of like my league partner and like that comforting between the 10 feet to my ball when I didn't hit the ball well. But my point is, we're going to discover what that looks like. But does that mean there's hand sanitizer now on all of the on a golf cart, or that there's more of a hand sanitizer? The availability of that is just in more places now, because we appreciate that more and understand how those simple things reduce disease transmission. And we have the power. I don't need to have 6 years of schooling to figure out how a disease is transmitted. When the experts tell me that I just need to follow these 3 steps or 4 or 5 steps, we can do that. And I think we just got to give the public a little bit more confidence at times and a little bit more credit for the good work that they're doing. And I couldn't be more pleased with the West Bloomfield, Kego, Sylvan, and Orchard Lake communities that the West Bloomfield Fire Department serves. And I know as far as this Megacast is going, all of those communities throughout Oakland County, they're just doing a fantastic job of reducing disease transmission. Dave, remember, we're one of the top counties for disease count. So for confirmed cases, we're one of the top ones. We're in that top 3. I think last I checked, we were in the number 2 position, but you got to watch that Wayne County, Detroit. They kept those separated out. So,
well, and this is why I like Greg Flynn. This is why I like doing the Megacast, because the conversation we just had isn't going on anywhere else. People aren't ready to have it. And you said what we are hoping to hear from an awful lot of people that, I think the public at large, sure, there's been some people out there that haven't done a very good job. But by and large, we are going to see a high level of success because the public has done what they've asked. People aren't driving around. They are staying home. They are washing their hands. And you know what? I think we as a community here in Oakland County can continue, even though we might be number 2, can do the next level of things that we need to do, but we got to be trusted to be able to do that and move on. So this is going to be fascinating to see how this goes, and I hope that together we are able to plot the proper course and do this in a way that lets business continue to go on, let some of us get back to doing what we want to be doing with our time and get our economy going back, and then make sure that we're taking care of all of our health. I have confidence that that'll happen. But this conversation has to start happening, and hopefully that will. I want to just take 30 seconds and go backwards, and it might take more than 30 seconds, and just kind of rewind and look back. Greg Flynn, Fire Chief, West Bloomfield, and glad to have you here for this conversation because you and I have been doing this for several weeks now. If we went back and said when we had this first conversation that we would be the number 2 county, that basically we know we have lost a lot of people and a lot of people have gotten sick, but a lot of people have recovered. That we are handling this as a community. We have not had massive civil unrest. We, by and large, this thing has gone pretty well. Considering what we've been dealing with and all the plans and work and effort. I mean, I assume that you have the capacity today to respond to the 911 calls, and you have somewhere to take patients, and they are going to get care, and we don't have people scattered out on the streets in gurneys, which we weren't so sure about a month ago. I mean, this has gone, pretty well from my perch. So
agreed, and we make these comments very carefully because we will be judged when we're all done with it. But it's similar to what I say to Danielle and I, to our kids. When you prepare for that exam or that test at school, and they come home and I ask them how'd they do, and they said, "Well, it was easy. I did fine," right? Because we were prepared. I'm not implying that this has been easy or the stressors but we have been prepared. We're prepared with our partners at Henry Ford. We're prepared with our partners at the county EOC. We're prepared with our partners at the State Emergency Operations Center and our partners at the federal level. it is working. I think sometimes, just in my opinion, and you're a broadcaster, I'm just a fire chief. So, I mean, I drive a desk now for a living. But my point is the politics of it, I think sometimes we lose and we want to focus on some of the things that we need to maybe make an improvement on. But there have been so many successes. You're seeing on social media the hospitals that are putting up the dry erase boards to show the number of folks off of ventilators and successfully discharged after a COVID-19 diagnosis. There are success stories and there's tragedy, but there's tragedy with all disease. And we're not even highlighting that right now, that cardiac disease and diabetes and stroke and all these other things that are going on at the same time. So it's a complex discussion, Dave, but we need to start to find, where we're going to go and where this is going to take us, because it's going to be here before you know it. And that same planning that has helped us weather this in as positive maybe a light as we can, that same amount of planning is going to need to go into that next phase. And we need to start having those conversations like you said. So I look forward over the next couple of weeks to hear what that looks like. When our parks open, from Director Tucker, what's that going to look like? When Town Hall opens and you talk to the supervisor in the coming days, what's that going to look like? It will be different, but the service is still going to be there for the community.
And the beauty of this show is that that planning is happening right now. That we don't know exactly how it's going to be executed. That's a good debate. We'll have it, and it's going to happen on a national and statewide level. But here we're already planning. We're discussing it here in front of the public, which I think is great. Thank you, by the way. Thank you for doing this. And we're putting a plan together. And I think the best quote, with all due respect to all the wonderful things you have said on this broadcast over the past several weeks, the best quote that we had from anybody came from our friend, the former principal at West Bloomfield High School, and now the superintendent of Bloomfield Hills Schools, Pat Watson. And it's not surprising that he would say something quotable. He said, "Hope," he said, "Dave, hope is not a plan." And that's true, and that's what we've been implementing. We all hope for the best, but we are planning. You have planned. Everyone who's been on this show is planning, from the docs to the people, to the hospitals, to everybody. And that's going on right now as we try to plan our way to what next week, next month, next year is going to look like. And I appreciate all your thoughts today. Anything that we need to share with the public, anything that we need to work on, do a little better, or anything that Chief Flynn you'd like to share with folks around Oakland County?
Well, I always appreciate this opportunity, Dave, for you to let's get a couple messages out. Number one, I want to share three things. First is I want to reemphasize the flushable wipes, and we talked about that a few interviews back, and just to underscore that, and you gave me a great quote for that one. But if those are not flushable, and we don't want to have any issues with our sanitary system. So please do not flush those things that are called flushable wipes. Number two, make a face covering. There are lots of, the Surgeon General has a YouTube video on how to make one out of a clean t-shirt and 2 rubber bands. And I'm sure there are many other great Pinterest and YouTubing type videos out there to make a face covering. It's okay. Do it. When you're out in large groups, the face covering does a couple things. It'll provide you some protection, but also a reminder to, as one of our talking points, is to not touch your face, not touch your eyes, touch your nose, touch your mouth with your hands. And that face covering will help you do that. And number three, encourage you to fill out your census paperwork. You can do that online. I know that that's a message that the township clerk has been passing on. I want to underscore that. The census plays a role in government's ability to respond to these types of incidents. And we need everybody in West Bloomfield, the Tri-Cities, all of Oakland County and the great state of Michigan to do their census and get that completed. That'll be helpful in the less work the census workers have to do in going door to door. So please complete your 2020 census.
Fire Chief, West Bloomfield, Greg Flynn, thank you very much. Been a great leader throughout this whole process. We appreciate it. Good chatting with you again, and best to you. We salute our first responders. The work you're doing, the work the medical community is doing is heroic and dangerous, and it is greatly appreciated. And thank you very much for everything.
You bet, Dave. Thank you.
All right, Greg Flynn, Fire Chief, West Bloomfield, joining us here on the Megacast.